What is emergency scene management? Emergency scenes generally begin with confusion as people realize there is an emergency unfolding in front of them. No one knows what to do first, who should be in charge, or how they can help. In this situation, the first aider needs to follow a sequence of actions that ensures safe and appropriate first aid is given and everyone's safety is protected. First aiders use emergency scene management (ESM) to do this. Emergency scene management is the sequence of actions you should follow to ensure safe and appropriate first aid is given. Steps of emergency scene management. 1. Scene survey. During the scene survey you take control of the scene, find out what happened and make sure the area is safe before assessing the casualty. 2. Primary survey. Assess each casualty for life-threatening injuries and illnesses. Call or send someone to call 911 and give life-saving first aid. 3. Secondary survey. The secondary survey is a step-by-step way of gathering information to form a complete picture of the casualty's overall condition. 4. Ongoing casualty care. During ongoing casualty care you continue to monitor the casualty's condition until medical help takes over. Scene survey. Take charge of the situation. Call out for help to attract bystanders. Assess hazards and make the area safe. Find out the history of the emergency, how many casualties there are and the mechanisms of injury. Identify yourself as a first aider and offer to help, get consent. Assess responsiveness. Primary survey. Check for life-threatening conditions, the ABCs. A. Airway. B. Breathing. C. Circulation. The sequential steps of the primary survey should be performed with the casualty in the position found, unless it is impossible to do so. The primary survey should begin immediately after the scene survey. Secondary survey. A secondary survey follows the primary survey and any life-saving first aid. It is a step-by-step way of gathering information to form a complete picture of the casualty. In the secondary survey, the first aider is looking for injuries or illnesses that may not have been revealed in the primary survey. You should complete a secondary survey if the casualty has more than one injury. Medical help will be delayed for 20 minutes or more. You will transport the casualty to medical help. The secondary survey has 4 steps. 1. History. 2. Vital signs. 3. Head-to-toe exam. 4. First aid for any injury or illness found. Ongoing casualty care. Once first aid for injuries and illnesses that are not life-threatening has been given, the first aider will hand over control of the scene to the casualty, or someone else, and end their involvement in the emergency. The first aider will stay in control of the scene and wait for medical help to take over, or the first aider will stay in control of the scene and transport the casualty to medical help. The first aid must maintain the casualty in the best possible condition until handover to medical help by giving first aid for shock. Position the casualty based upon their condition. Monitoring the casualty's condition. Recording the events of the situation. Reporting on what happened to whoever takes over. Instruct a bystander to maintain manual support of the head and neck if head spinal injuries are suspected. Continue to steady and support manually, if needed,